Okay, well, good afternoon. I think we'll go ahead and get started. And I want to thank you for being here or tuning in remotely. Before I begin the press conference this afternoon, I'd like to acknowledge that the state of Iowa and the journalists who cover it lost a real icon yesterday with the passing of Dean Borg. He was a longtime host of Iowa Press on Iowa PBS, and for decades he brought Iowa government and politics into our living rooms. He brought the curiosity and fairness of an inquiring journalist and an unwavering pride in both of his state and his Forest City roots to help keep Iowans informed about their government and its leaders. He will be missed, and Kevin and I extend our heartfelt condolences to his family. So I'll go ahead and start with an update on the number of cases of COVID-19 that we released earlier this morning. Today, there are 15 new positive cases. The State Hygienic Lab had 8 positive cases, and 173 negative. That brings our total of positive cases in the state of Iowa to 105. It brings our total negative cases in the state of Iowa to 2,043. The total number of counties now are at 26, and we have 7 individuals hospitalized as of Sunday at 6 p.m. As expected, the number of positive cases is increasing, in large part due to the expanded testing capability. As the volume of testing continues to expand, we will likely see that number grow for a while. I want to reiterate that under the public health emergency declarations that I signed last week, we continue to work to slow the spread and mitigate the virus's effect on Iowans, provide regulatory relief for those impacted, and remove legal barriers to prevent us from responding to this disaster. You can find information on the health declarations at coronavirus.iowa.gov. We also continue to monitor and discuss additional steps that can be taken to support our efforts in these unprecedented times. All the necessary actions that we've taken at the state level have come with consequences to Iowans, including our small businesses. Iowa's small businesses are the lifeblood of our communities and the engine behind our economy. And that's why it is critically important that we take steps to help and support our small businesses during these challenging times. It's clear from social media and news reports that Iowans are stepping up to try and support restaurants, bars, and all of our small businesses. And I want to thank every Iowan who has taken action with their own buying decisions to buy local and support Iowa's small business owners and workers. On Saturday, we announced that the United States Small Business Administration had issued a disaster declaration for the entire state of Iowa. The action allows Iowa small businesses negatively impacted by the pandemic to apply for low-interest support loans. The SBA, through the Economic Injury Disaster Loan Program, can provide up to $2 million in loans at a very low interest for the term of up to 30 years. I want to thank the Trump administration and SBA. They were accessible, responsive, and acted fast, which is good news for Iowa small businesses. So today, I'm also announcing new state-based disaster assistance for small businesses. This is a 3-pronged plan developed by our teams at the Iowa Economic Development Authority, the Iowa Department of Revenue, and Iowa Workforce Development, whose directors are with me today. We're making funding available for small grants to employers with 2 to 25 employees, and these grants will range from $5,000 to $25,000. In addition, the Iowa Department of Revenue will automatically extend the sales and withholding tax deadline for any business that gets a grant and will consider an extension for any business that applies for a grant. In addition, Iowa Workforce Development will allow businesses with fewer than 50 employees to delay their unemployment tax payments for the first quarter until July 31st. These 3 actions will provide some much-needed relief for struggling small businesses as well as some help with cash flow. I fully understand that this doesn't make up for having your businesses closed for a period of time or your customers staying home, but it is our hope that we can help businesses weather the storm, and as governor, I want you to know that I'm committed to helping them do just that. Again, I want to thank the 3 directors with me today for their outstanding work in coming up with solutions to help Iowa small businesses in these times of uncertainty. And now it is my pleasure to introduce Director Debbie Durham of the Iowa Economic Development Authority to give us a few more details on the grant program. Debbie?
Thank you. Thank you, Governor. Tens of thousands of Iowa's businesses and their employees have suddenly been launched into an extraordinary new reality. There are no maps or instruction manuals for this reality we find ourselves in, but what we can do is act swiftly and act with purpose. To ensure that we have a full understanding of the economic impact of the COVID-19 pandemic is having on our businesses in all industries, we immediately engaged with the University of Northern Iowa's Institute for Decision Making and Strategic Marketing Services to administer a survey of Iowa businesses. Personally, we've also reached out to all of our business sectors, financial institutions, and anyone else as far as the trade organizations to stress that we needed to hear from them and their member businesses about their immediate needs. To date, we have received more than 12,000 survey responses from businesses in all 99 counties. I encourage all business owners to complete the survey, which remains open through today at iowabusinessrecovery.com. Business owners have been sharing that a wide variety of assistance would indeed help them, including various forms of financial assistance and tax deferment. We will be able to act with purpose to assist our businesses. And today we're pleased to share that the Iowa Small Business Relief Program offers a one-stop shop for Iowa businesses seeking such assistance. Again, I'd like to also thank our partners at the Iowa Department of Revenue and Iowa Workforce Development and our great team at the Iowa Economic Development Authority for their tireless efforts to prop up a program that didn't exist just a very few days ago. While businesses only need to complete one application to apply for both forms of assistance, the eligibility requirements do differ. To be eligible for the Small Business Relief Program, grant business must be experiencing business disruption due to the pandemic, have employed between 2 to 25 people prior to March 17th, and to be eligible for the deferral of sales and use or withholding taxes and waiver of penalty and interest, business must only be experiencing business disruption due to the pandemic, and there is no employment limit on this. The dual application for grant assistance and tax deferral will be available beginning tomorrow morning, I'm assured, at 8 a.m. The applications for the deadline is March 31st at noon, and at that time we will then continue to assess the situation of unmet needs. Thank you.
Thanks, Debbie, for that. We're also joined by Director Paulson and Director Townsend from Department of Revenue and Workforce Development, and so they'll be available also to answer questions at the end of this. But first, I want to take this chance to send an important message directly to Iowans. Again, this is the time that we need every Iowan to do their part to help mitigate and slow the spread of COVID-19 and keep essential services up and running. If you do not need to leave your house to help your family or other Iowans respond to this disaster, stay home. If your job allows you to work from home, do so. If you can keep your children home with you instead of taking them to daycare, do so. If you are an employer with a workforce able to work remotely, help them work remotely. Limit your time away from home to trips for essentials like groceries, medications, and necessary supplies. Send just one family member out for errands. If you work in essential services like healthcare, emergency services, food production and supply, manufacturing, or transportation, you are on the front lines of our response efforts. Thank you for your sacrifice, and stay safe by practicing social distancing and careful hygiene. And again, if you are sick, please stay home. Now is a critical time for our state, and I am counting on every Iowan to be responsible for their own health and the health of others by doing the right thing now. So stay at home and help us save a life. We're all in this together. So with that, we'll go ahead and open it up for questions.
Governor, the funding for this new small business relief program, is this coming from anything that the legislature did on the final day of before suspending the session? Is this because of transfer authority or that emergency funding?
I am able to use the economic emergency fund, so $2 million comes from that and $2 million comes from Debbie's program. Do you have anything to add to that, Deb?
Right, because under the governor's transfer authority that we are taking $2 million that we already have appropriated for this year and reallocating to this. And again, after the week window, we'll assess at that point if additional funding that we may be needed, and we'll deal with that at that time.
So to be clear, the total for the program right now is $4 million?
Yeah, to roll out to begin with. But it also will allow us to assess the need, and we believe that there will be a lot. And so this will be very helpful, as if we need to tap into additional funds, we'll be able to provide that data to the Legislative Council if we need additional funds going forward over the ability that they have given me in the last days of the legislation.
All right, let me also stress that this money that we're talking about is simply a stopgap. This is a stopgap to basically keep doors open, because the first thing we're dealing with is keeping as many people as employed as possible. Secondly is liquidity. And so this is a stopgap, very short period of time until the resources from the federal government begin to flow. So this is not intended to keep people, at the same operating level for like 90 days. It really is that 30-day until we know what assessment's coming from Washington and when that is going to be there.
Yeah, that's a really good point. Thanks, Debbie. And hopefully we'll know that sooner rather than later. Thanks.
Is there any consideration of the other funding from that $20 million that you're authorized to use from the legislature?
We're evaluating that every day, and we're working with the team that's standing up here with me, and they're reaching out and talking to the business. And as Debbie just said, this will be the stopgap. We'll see what's available from the federal package that they're working on right now, and we'll continue to assess on a daily basis and see what that looks like.
Director Durham, do you have a sense for which sectors are maybe in more danger right now with all this, and is Iowa in danger of losing any major employers?
Well, we certainly haven't heard that. I mean, basically the survey, like I said, it came from 99 counties, and every industry is covered, including nonprofit in this. The ones that we are hearing about right now, though, that are looking at things, the cash flow issue within the next 30 days are those consumer-facing industries, as you would expect. We're working with some of our innovation platform folks as well, those that are in the startup. Most of them are saying that they've got enough that they can operate for about 60 days, and then we'll need to look at that sector of our clients that we serve as well. But right now, it's really those consumer-facing industries.
Could you expand on what some examples of what those are, consumer-facing industries?
Okay, great. Yeah, that'd be good.
So we have run the numbers in terms of the occupations and industries that are filing the highest number of unemployment claims. Currently, not surprising, it's the accommodation and food services by far have the most claims, followed, not closely, by education services. Those are your hourly school employees that are filing for unemployment. Thankfully, we have not seen a significant increase in manufacturing, which is a good sign for Iowa's economy.
There have been some large companies in the state that have had people who have either been in their building or worked for them tested positive for COVID-19. I know you've closed down these consumer-facing industries, but do you see a point at which you would have to tell other businesses to stop having their employees come in, seeing as, maybe they're closing down too late and they've already found someone who has COVID?
So I pointed this out yesterday on one of the calls that I was participating in. The Department of Public Health actually has a Q&A for businesses, and that provides some really great resources for businesses across the state to help them make that decision. Provide work from home opportunities to their employees if they can do that. If they have employees that are sick, make sure that they know that they should stay home and they can stay home. So that's a good place to start with that information, and then we'll help them work through some of the decisions. We have to make sure that we're providing essential services, and that applies to a lot of the businesses that we have in the state of Iowa, especially when it comes to food production and food supply. And so we want to make sure in our healthcare professionals, and we want to make our state employees that are providing essential services every single day, that are still on the front lines, making sure we're providing the resources that Iowans expect. And so we really need businesses, thinking about what they're dealing with in their own company, and then utilizing the Department of Public Health and some of the resources that they provided to them to make those decisions.
Governor, and maybe Sarah, what data or evidence, when you have to make these big decisions of what recommendations to make to urge closures, whether or not back to when you had schools and are still whether you consider shelter in place, what are the data, what are the evidence you're looking for to help you inform those big decisions?
So I'll let Sarah talk about some of the things that they utilize from the Department of Public Health, working with CDC and other states and the experts that they, are able to coordinate with to provide the information that we're looking for. But we're doing that across all sectors, whether it's the healthcare industry or it's manufacturing or business and industry, or just utilizing our own Department of Transportation to help us build out those metrics to help us make the decisions. So for instance, some of the information that we gathered today, which I think is a really good indicator that Iowans are starting to really listen and take the heat. Overall traffic with passengers on rural, municipal, all secondary roads, just overall traffic has seen a 47% drop from a year ago, but yet truck traffic is normal. So we are seeing the essential services being delivered. So I think, people that are providing the essential services are still out there, but Iowans are starting to hear the message and they are staying home. And we were looking at the numbers over the days since we've made the recommendations and laid out the different policies that we put in place, and you can consistently see the numbers going down. So that's an example of just different metrics that we're looking at to help us, understand that if what we're asking Iowans to do is working, we need to take additional steps and what that looks like moving forward. Sarah?
So from a public health perspective, we look at a number of different epidemiological factors in making these sorts of recommendations to the governor. So things that would be included are rate of hospitalizations, length of hospital stay, anticipated spread of a disease within a particular community, the rate by which people with underlying health conditions are becoming affected. And so there are a number of factors like that that we look at. We look at the whole picture, and we do that, and we have conversations with local public health experts as well. And so we are in the process of having those conversations every day and continuing to evaluate what's happening here in our state, as well as what's happened in other states and in other countries as we look to make those recommendations to Governor Reynolds.
In addition to that, our National Guard, this is what they do. They are prepared to respond and to be prepared and respond in a manner that we need to, and they are working in close collaboration with Homeland Security. So between the two and really the procedures and the way that we bring the request in, we prioritize what those look like. It also gives us an opportunity to understand where the need is at, if we can isolate it in different hotspots. So the way that we are gathering the information and funneling it through the system using the resources that we have in place is very beneficial as we move through this.
Senator Rand Paul tested positive for COVID-19. He had 0 symptoms and he was out and about interacting with other people. It seems like up until now you've mostly just been saying that sick people should stay at home. I mean, have you changed your tune on that? And because it seems that couldn't everyone potentially be contagious?
Well, I'm going to have you ask that. But, it has been, if you're sick, stay home. But it's also been the message that if you can work from home, make sure that you do that. If you're to employers, figure out ways, if you can, to split your workforce. Have half of them work at home, half of them work at the office, and then flip. So it's a combination. Make sure that you're only going out for things that you need to be going out for. So it's a compilation of all of that. And I think maybe we've decided we need to hit a little heavier on, don't go out if you don't need to. Go to a park, but practice social distancing. I mean, you can still do some of these things. We just have to keep all of that in the back of our mind and think about who we potentially could be impacting by, going out and doing things. And so it's kind of a two-front effort. But Sarah, do you want to talk about some of the...
Yeah, so I think that one of the things that we think about is that we have community spread of the virus in our state at this particular point in time. And so I think we should all presume that there's a potential that we might get exposed to coronavirus, even if we're well and even if we're healthy. And so the guidance is to stay home as much as you can, because even though 80% of people that might be infected with the coronavirus will have mild symptoms, kind of like a cold, there's the potential that people with underlying health conditions, elderly people, that they will be more severely impacted if they are exposed. And so to the extent that the rest of us who might have a mild illness, if we can prevent becoming carriers of the virus, that'll help slow the spread of the disease in our state, and that's what we're hoping to accomplish.
Senator,
Last question in here, and then we're going to the phone.
although with being asymptomatic, Sarah, this might be a question for you still. There's been kind of the repeated advice that you're most contagious when you're symptomatic. I'm wondering if that, given the evidence about some asymptomatic people and not being able to pinpoint if they're, serious spreaders or not, is that still the medical, stance? Is that you're most contagious when you're showing symptoms?
That's been the most recent information that I've received from our medical director, Dr. Padati. Her advice on that particular point has not changed. So we do continue to believe that people are most likely to spread the coronavirus when they are symptomatic. But because we could all be carriers and some of us might experience mild illness, we would still encourage people to stay home to prevent potential exposure and to avoid being those carriers that might have a negative impact on our loved ones and our community. Thank you.
Next question is going to go to Barbara Rodriguez at the Des Moines Register.
Governor, I'm going to, fall back on this conversation about asymptomatic individuals. I just want to make sure I understand whether, given the emerging data that shows and that individuals who are not showing symptoms could have coronavirus, isn't the time for pushing more individuals to stop traveling unless they have essential work in the state?
Mm-hmm. Well, I would say that we are, and I think Sarah just walked through some of the metrics that Dr. Padati is using when we're most contagious, but that's basically what we're saying. Unless you have to travel, don't. Work with your employer, work from home if you can. If you're part of the essential workforce, practice good hygiene. If you're sick, stay home. The other thing that we can do is we've done this a couple different times. I think it helps get the message out because there is, I think, some confusion. We can maybe have Dr. Padati do another Q&A or do a social media video just to help get some of that information out.
Aaron with Channel 13, you have the next question.
All right, thank you very much. Thank you, Governor. These questions actually come from our viewers, and they're along the same lines, both having to do with reducing the spread. So sort of piggybacking on what Barbara just asked with regard to reducing the spread in terms of density, it seems obvious that a lot of Iowans are not getting the message about staying home, whether it's from work or play dates or the park. And I think we just had an alert come from the city of Des Moines that they're actually closing playgrounds at the parks or declaring them off limits. So first part of the question is, do you think that we need some sort of order in place telling people, ordering people to stay home if they aren't part of these essential services? And then secondly, along those lines, what are we doing to increase testing to make sure that those who are positive aren't coming in contact with others?
So at this point, we are not at a place where we're going to would order a shelter in place or a stay at home. We are continuing to evaluate what those metrics look like. We had a group that was working on that last night and continue to work on it through the day. We want to make sure that we're making these decisions based on data and based on metrics so that we can be consistent in what we're telling Iowans to make sure that we're not shutting down a state where we don't need to. So we need to be factual, we need to be reasonable, and we need to be consistent in the message that we're providing Iowans. I think up to this point we've been very consistent in using data to make the decisions that we're making. We're giving a lot of recommendations on how individuals and businesses and employers can walk through what we're asking them to do. The Department of Public Health continues to be a great resource. They have a lot of question and answer documents on their website that people can go to and look. You can call 211 or go to the website. There's other areas where you can get questions answered. Testing, We continue to, we're increasing capacity through the state hygienic lab, where they're testing all of the, they're getting through all of the ones that are sent in every night, so we're able to address all of the specimens that have been sent in. In addition to that, Iowans, if they are sick, if they have a fever, a cough, or they're having respiratory issues, they should call their physician. The physician will walk them through an assessment, make the decision if they need to come in to have further testing, and they have the capability of going through other labs to get those results. So we have somewhat, although they've been broadened, some specific criteria for who we're testing at the state hygienic lab. We want to make sure that we're focusing on individuals, I think, that have been hospitalized. You want to run through that? I don't want to give out some wrong information.
Sure. So the current state hygienic lab criteria for testing include all hospitalized patients with fever and respiratory failure and no alternate diagnosis, older adults over 60 years of age with fever and respiratory symptoms, including cough, difficulty breathing, and chronic medical conditions like diabetes, heart disease, immunosuppressive medications, chronic lung disease, or kidney disease. Any persons with fever or respiratory illness who live in a congregate setting like a long-term care facility, a dormitory, a residential facility, a correctional facility, or other sort of treatment facility, and then essential services personnel who have fever or respiratory illness, such as healthcare providers, fire and EMS, law enforcement, and residential facility staff.
Next question will be David Pitt, the Associated Press.
Yes, thank you very much. I'm interested in knowing about the data that you're using to make sure that we're staying ahead of the curve on the growth of numbers of cases. The U.S. Surgeon General has said that generally the U.S. isn't doing enough social distancing. I just am curious to know what you're using and how you know we are staying ahead of the curve. What makes you confident that we don't need orders to force more social distancing? Thank you.
Thank you. As I mentioned earlier, we're looking at a number of different factors. It's not just one or two different things. It is a range of information that we're looking at, and they include things like rate of hospitalizations for patients that might test positive, length of hospital stay for those patients, the age, the average age of a population in a certain area. Certainly density of the population, that's been brought up before. So there's a range of factors that we're looking at, and we are doing that evaluation in consultation with local public health authorities as well. And so as soon as we have done all along throughout the response, as soon as the Department of Public Health comes across information or reaches a conclusion that more aggressive community mitigation guidelines or requirements are necessary, we will advise Governor Reynolds about that immediately. And so we haven't quite gotten there yet, and we hope that by people staying home, specifically and especially when they're ill, that we will be able to prevent some of those more strict mitigation measures, but we're prepared to make that recommendation when the data shows us that it's time.
And that has been the process that we have used with each decision that's been made, so I appreciate their work in that.
Chris with KCCI, go ahead.
So you mentioned with that data, I mean, if we reach the upper bounds of that, if this gets to the worst case scenario kind of scenario, do we have enough hospital beds in this state to treat everyone? And what sites have been identified as backups? I know other states are considering using hotels, et cetera, et cetera.
And they are working through all of that. That has actually been missioned through the WebEOC. So we have a team in place that's working, really focusing on what we see might be some hot spots across the state so that we make sure that we can stand them up in the areas that need to be stood up. But those kind of discussions and decisions are taking place throughout the day so that we have the right response in place should we ever get to that place. Our hope is that if Iowans do what we're asking them to do, and by the policies and procedures that we put in place, that we will ultimately be able to bend the curve and spread this out and not have undue burdens placed on our healthcare systems. But you know, you have to prepare for the worst, and they've been doing that all along, and that's been part of the discussions in preparing for COVID-19 today, tomorrow, and into the future.
And then Beth with KCRG. Beth, we'll come back to you. Clark Kaufman with Iowa Capital Dispatch. Clark. We'll go Brian Morelli, Cedar Rapids Gazette.
Hi, Governor. A number of officials in eastern Iowa are kind of contemplating and grappling with whether to establish local shelter-in-place orders. And I guess my question would be, first, whether they legally can do that, and if that would be wise. And then, secondly, they are looking. They would prefer the state do a statewide order to have it be more uniform. And I guess what would your response be to those community officials?
Well, the same thing that we've said probably 2 or 3 times, and that would be to continue to coordinate with the EMAs in your county. They're on all of these calls that Dr. Badati has been on, Public Health has been on, the healthcare system, and then the local elected officials. That's why we're working really hard to make sure that we have those metrics in place that make sense so that communities across the state can make decisions based on the metrics that they're seeing. And so we want to provide them some guidelines to help them in making those decisions. And they had a great call last evening. I think, Joyce, you've been on a couple calls this morning with different communities in the eastern side of the state, but we're having those conversations statewide as well. So we're working to help provide the resources and the metrics to our local officials so that they can make those decisions. They do have the authority to do that.
Thanks, everyone.
Thank you. For the entire state of Iowa. The action allows Iowa small employees that are sick to make sure. In addition to that, our National Guard, this is what they do. They are prepared to respond.